So today, I was just gonna go over, yesterday I went over cardiac, endocrine, burns, and musculoskeletal. I don't think I pronounced it right, but okay. Today I was just gonna go over renal, urinary, respiratory, hematology. Okay, this disorder, and the GI disorder. So we're gonna go on page 98. Okay. So this is your urinary system, and urinary system. So you have your kidney right here, right? So with your kidney, you do have a lab value, which is this, your GFR, glomerular filtration rate, and your filtration rate is the rate of the blood flow through the kidneys. So you want to keep it between 90 and 120 millimeters per minute, because then that means that the blood flow that is going down here, that's coming down from the, I believe it's the inferior vena cava, and it comes in here through the renal vein and all of these, right? That means that the blood flow is actually like, it's the blood flow rate is accurate and it's getting filtered out and everything. So you want to make sure you know that. Definitely make sure you know your terms. Dysuria, pain while urinating, for patients that have UTIs, nocturia, right, for night, nocturia, excessive urination at night, especially for patients that have BPH or that benign prostate hyper something. The BPH, older patients, especially men. Hematuria is also important to know because patients that have UTIs, they do have some, blood in their urine. Patients that have urinary frequency, it's also important to know for patients that have UTIs, they constantly, are going and BPH patients as well. Incontinence is good to know because you want to make sure that that older patients, as they grow older, they they lack the ability to, their body just becomes like they're not sending like the signals that they need for like their bladder to like expel the urine, like how we are, like for us normal people. As you grow older, your body starts slowing down, and those like messengers, like the receptors and everything, it's just like they're not functioning as well as like when you're younger. So let's see, involuntary voiding during sleep. I haven't seen that one. But I know proteinuria, you do have to know because that does come up with on patients that have nephrotic syndrome. They do have proteinuria, which is protein in the urine. Oliguria and anuria is less than 400 millimeters per day. Anuria is less than 50 millimeters, or without urine, AN without. But definitely you want to make sure that your filtration rate is at least 90 to 120. Your bun, you want to make sure that it is 10 to 20. I do 10 to 20 for this one. Let's see. I'm trying to wait. Ten to 20. Oops. Am I doing it? No. Okay. 10 to 20 for bun. The higher it is, the more dehydrated you are. So The higher the bun, the more dehydrated. I'm not supposed to be dehydrated. Dehydrated you are. Okay. Your creatinine. The way I just remembered is if it's above 1.3, the kidneys aren't working. So if it's greater than 1.3, kidneys aren't filtering anything out. If they're not. And that's a problem because like if you're taking medications, you're not able to secrete that. Oh, and you know, you get intoxicated. So with the meds. So please make sure you know 1.3. For creatinine. Let me see. Okay, urine specific gravity. You want to keep it between 1.0. I remember it as 1.003 to 1.030. The higher it is, the more let me see. Oh, okay, okay, just kidding. Make sure you know your urine specific gravity because this has a different definition from what I thought it was, and I don't want to give you guys the wrong info. So please make sure you guys know your lab value for that. The higher it is, obviously, you know it's not right. It's not good. But if you were to have to look at this, your bun, the higher it is, the more dehydrated you are. That's good. Okay. Now, for acute glomerulonephritis, this one does show up on ETI, so it's very important to know. Very important to know your acute glomerulonephritis. One, they believe it's caused by untreated strep, right? Untreated strep. It decreases the GFR, but what you gotta know for this, it's important to know the signs and symptoms. If you guys have time, I know Simple Nursing does explain it a little better. It goes through the whole process of why, you know, it's strep, and how it gets dislodged in the glomeruli, which are, you know, are here, your little washing machine things. You do want to know that it does cause hematuria. This does show up on ETI. You do have only mild proteinuria, because in nephrotic syndrome, you're going to end up with proteinuria. But this one, you want to make sure it's mild. You do have hypoalbumin. You want to make sure you know that. Low albumin. Edema in the face and eyes. You're going to have increased blood pressure. And you don't want to give them sodium. Your labs are going to be increased. Your specific is going to be increased. So the ones that are highlighted are important to know for ETI. Interventions, because it's strep, which is bacterial, you give them, I believe, give them antibiotics. And you want to monitor their blood pressure, because if they're not secreting, the bun isn't working, so your creatinine is over 1.3 and it's not functioning. You know, they're retaining all this like fluid, leads to edema. So you want to monitor blood pressure. Give them antihypertensives like your beta blockers, or the ones that end in LOL. Diuretics like furosemide. That's a good one to give them. Definitely want to make sure you're monitoring intake and output, since their kidneys aren't functioning. So you want to monitor intake and output for them. Sodium restriction, because you don't want them to swell, and fluid restrictions as well. Decreased protein for sure. That does show up on ATI. I believe it does show up on ATI. You want to decrease proteins. And yeah, so that's what I believe is important for ATI. Acute kidney injury. You know, it's a damage to your kidneys. it has three different causes. It can be either, it can happen in three, oops, I don't know how to do that. Why? I want this unhighlighted. Okay, there we go. The thing is with acute kidney injury, it can happen either in three different sections. So it can happen in pre-renal before it reaches, the kidneys. Before it reaches the kidneys, what organs are up here, right? Like if you think about it, the anatomy, like where your kidneys are sitting down here, and your heart is somewhere up here, right? So damage for your kidney, so your heart, so you have a cardiac problem. So if you have like hypertension, right, and your heart is pumping out so much blood to the rest of your body, that causes a problem in your kidneys when it reaches, right? Or impaired cardiac output. You're not pumping out enough cardiac output. That can also be, a problem. If you are having GI losses like nausea and vomiting, I want to say those two, but I wouldn't focus on these too much for right now, at least for just ATI. For NCLEX, you do want to know the whole thing. Simple Machine has a video on this, and they do explain it. They show pictures and everything. So it's important to go watch it. Intrarenal is within. So now, after you're done with the problems that you have up here, right, which is pre-renal, before you reach the kidneys. Now you have intrarenal, which is within the kidneys. So which is now damage in the kidneys, right? And so now what problems can you have? You can have what's it called? Nephrotic drugs that hurt the kidneys, like contrast dyes. If you take I believe it's mucomist, but if it's the actual trade name for it, I think is acetylcholine, which is the antidote for Tylenol. Some people, sorry, if you give that, I think you would give that to protect the kidneys from shoot, I forgot, but I know it's given to protect the kidneys, that drug. I believe when they go to get a CT contrast, they're given that. But just know that it does help the kidneys. Another one would be infection, like we said previously, glomerulonephritis, where an untreated strep infection goes in here through the systemic blood flow, reaches the kidneys, and you have a strep infection. So yeah. Post-renal is after the blood goes from here up here in the heart, goes in the kidneys and out, right down to the urethra, or ureter. I forgot. Sorry, down here. This little the tubes, the ureter. So we can have renal calculi, right? Your stones when you're dehydrated, BPH, especially for older patients, blood clots that get stuck in there, maybe tumors. But the main ones you want to know is these three. Right now, let's not do the phases, but just in general, like if you have kidney damage, you're gonna have like an onset, right? Whatever it is, it can be a problem in your pre-renal, intra-renal, post-renal, like it's stated right here, right? And you want to correct it. So this is what's gonna happen first. First, you're gonna get the onset of like pain or whatever. Let's say you have stones in your ureter, right? So now you're gonna have a phase of oliguric stage where you're producing less than 400 millimeters in less than 24 hours, and your GFR is decreased, right? Your filter is not filtering it out. So now after that, we give you furosemide. How do we do that? We give you where is it? Because you're not secreting. Well, interventions you want to be monitoring for intake and output, daily Daily weights will give you a diuretic like furosemide, and that causes, your stones to come out. And then your recovery lasts for for a while. But if you didn't understand how to explain it, don't worry about it. I mean, it doesn't really show up on ATI. But you definitely got to know these signs and symptoms for glomerulonephritis: edema, hematuria, mild protein, swelling in the face, the edema in the face, blood pressure is going to be elevated. You want to decrease your intake of protein. You want to make sure that you're decreasing sodium for sure, monitoring intake and output. So this is like a nice to know, but like not necessary for ATI right now. Nephrotic syndrome, you definitely gotta know nephrotic syndrome. Definitely know that it is caused because of let me see right here. All these things. But you don't gotta, bacterial infection, I would say, is the most important one to know out of all these. You definitely need to know your signs and symptoms. They're gonna have low albumin, edema, fatigue, and loss of appetite, hyperlipidemia, but I would say low albumin and edema. And definitely see, this one has a bunch of proteinuria. There is one question that they always have on ETI where it's like, oh, they state where the patient has nephrotic syndrome. I think like what lab would you expect to be high or something like that? And that would be proteinuria. They do definitely have a lot of protein, a lot of protein loss. They do have edema, generalized edema because of the fluid shift, right? So definitely generalized edema. Don't do this. And hypoalbumin and edema. Interventions, like we mentioned, the other one, if your kidneys aren't working right, which are important for like secretion of like medications and filtering out blood, you want to monitor your intake and output, your weights, right? Your abdominal grid. Make sure sodium for sure, decrease that because you don't want to increase the water, that you're holding in within your body, which is going to increase blood pressure. Diuretics is, important to give them so they can secrete the fluid out from their body. Right now, I think those are the most important ones to know. Chronic kidney disease. So, like we said, your GFR we wanted above 90. Let me see. So if you have chronic kidney disease, right? Progressive or irreversible kidney disease, like it's like late stage, like over time, your kidneys aren't functioning anymore because either of diabetes, hypertension, right? If it's irreversible, and if you have, like, let's say patients, they have end-stage renal disease where your GFR is not eliminating, like, it's not functioning correctly, right? It's not filtering out blood correctly, then the treatment you have only treatments you have is dialysis or kidney transplant. And every body system is affected if your kidneys aren't functioning, right? You do get LOC confusion, especially, side note, patients that have UTIs. There's this thing where they get delirium, and they'll show up on ETI sometimes. Type it out. I can't type it out here. Side note, but patients that have UTIs, they have delirium. I suck at spelling, but they have delirium, and delirium is a temporary like confusion that you can fix if you fix the problem. If you can fix and can treat the bacteria or whatever is causing the UTI, then the illusion, the confusion will disappear, will be gone. But it does, the kidneys, it does affect a lot of things like your heart, you know, you're gonna have ammonia breath, increase libido. Labs are going to be increased, all of them. They're all going to be increased. That's important to know, especially bone creatinine and potassium. Those pertain to your kidneys. But what you have to know for at least for chronic kidney disease that does show up on ATI would be this. This is important to know because you do have two types of, like we mentioned here, dialysis, hemodialysis and peritoneal dialysis. Hemodialysis is given 3 times a week. Given 3 times a week, 4 to 5 per treatment. It's important not to miss a treatment because if you miss a treatment, you increase your chance of having. Let me see right here. It will increase your potassium, and that will lead to an EKG dysrhythmia. It's important not to miss a treatment. Before hemodialysis, it's very, very important that you have to check this. You have to check, assess your fistulas. Your fistulas or your graft. You have to feel thrill or hear a bruit. This is very important to know. Oh, okay. I'm sorry. How do let me just underline it. I think it's easier. Okay. Okay. I can do it. Yeah, I don't know how to do that. But you definitely want to make sure you know that you definitely want to make sure you know this. You make sure you feel a thrill. We assess your fistulas or a graft, right? Joining an artery to a vein or a graft. Both require surgery. And when you hear a thrill or hear a bruit, and if you can't hear this, you have to alert the HCP because then there's a clot. Then that can indicate that there's a clot. You definitely want to make sure you monitor your weight prior to so monitor weight prior to starting, right? And afterwards. So monitor weight before and after. Assess for the thrill and bruit, and if you can't hear it, then you have to let the HCP know. I forgot to tell you guys, hemodialysis is treatment used to filter out the toxins in your body when your kidneys aren't functioning anymore. Because GFR, remember, it's below 15. So yeah, they're gonna have disequilibrium syndrome because they can have this if the fluid that is being taken out of their system through via hemodialysis, if it's removed too quickly from the blood, the brain swells and this can lead to coma. So you want to make sure you assess for disequilibrium syndrome, any restlessness or confusion that is indicative of that. You want to make sure you hold all your meds. So you want to make sure you stop all your meds, your blood pressure meds, your nitros, your everything, your antibiotics, whatever you're taking, except for insulin and calcium. Insulin and calcium are fine to take. So insulin, I'm sorry, I'm just gonna, okay, insulin and calcium, and in conjunction with like your hemodialysis, we do give patients IV heparin to prevent clotting. So it's very important that you guys know that you avoid any tight clothing, you stop, don't carry any bags. You want to make sure you do blood pressure readings on an arm that doesn't have the place where they're taking the analysis, where they're treating it. You want to make sure you don't sleep on that arm, and yeah. So, but the feel and thrill does show up on ATI, so please know that. Peritoneal dialysis for ATI, you would have to know that it goes in like this, right here. You have to warm the solution to, let me see, I'm trying to figure out if it's body temperature or room temperature. I want to say it's you want to warm it up to, I can't remember if it's body or room temperature, but make sure you warm it up. You don't give it cold, you don't give it too hot. You want to make sure that's warm. You want to be careful because it does cause like peritonitis. It could cause peritonitis if there's an infection in the bladder, right? When you're spiking it, you're using sterile technique. You want to take their weight before and after, assess for any infection. They can do this at home. It's very important to know that you want to warm the solution that does show up on ETI. Warm the solution. It is by gravity. The disylate solution, the drainage, infuses waste. Let's see. You can do this at home, but you want to make sure you assess for this. That can happen. Assess weight before and after. UTIs, they're not very pleasant to have. I feel like, I've never had one, but this is, the anatomy of the kidneys. So what are causes? So you can have, if you're pregnant, right? Pregnant people, they prone to UTIs, especially more females, because you have a shorter urethra. You always want to wipe from front to back. You don't want to do any what do you call it? Baths, showers are better, and cotton underwear. Education. So you have to know, take the whole antibiotic course. Never stop it abruptly. Wipe from front to back. Avoid after intercourse. Avoid caffeine, alcohol. Avoid frequently. Don't hold it in. Avoid tub baths and perfumes down there, and wear cotton underwear. It's important to know. Signs and symptoms, you get fever, obviously, because you're gonna have bacteria, leads to increase of ABCs, fever. Dysuria, which is pain while urination. Smelly urine, for sure. One ATI, nocturia, urgency and frequency that show up on ATI. Burning on urination that show up on ATI. Hematuria that show up. And obviously fever and WBCs go along with it because they're going to be elevated. So that does show up on ATI. You want to make sure you're drinking 2 to 3 liters per day. Your antibiotics, right? This medication right here, your pyridium, I don't know how to pronounce the other word, but this is important to give, and this is important to know because it does show up on ETI. What you want to know about this, if you have the card for this, you want to make sure that you know that it down here. You want to make sure that pyridium is not an antibiotic. It only helps. It helps with helps alleviate the signs and symptoms like the dysuria, the urinary frequency. It helps with the symptoms, but it's not like an antibiotic. You do want to make sure you do want to make sure that you watch out for, it does cause red and orange like secretions, and that's completely normal. You want to make sure that you assess for liver values, like ALT, AST, and jaundice, because that's an adverse effect of med. You can drink cranberry juice. Okay, I think it's cranberry juice. And that would help with that. You definitely want to make sure you're drinking lots of water, following all precautions to like not having eyes. Let me just make sure I can get the right information. Okay, so yeah, for sure. Normal to have red and orange urine and body fluids. Report any jaundice. And cranberry juice, cranberry supplement is fine, right? But you definitely have to make sure you know that medication for UTIs. Renal calculi, this is where you have calculus in like stones, aka stones in your urinary tract, your kidneys. You can have it up here, right? You have it down here or here. Stones in the kidneys, stones in the ureter. This is called ureterolysis, which is in the ureter. Nephro. I don't know how to pronounce that, but it's right here. Or you can have it in the bladder. So it's important to know that it can be anywhere. Here, ureter, and your bladder. Signs and symptoms, definitely you're gonna have pain. You're gonna have hematuria. It's important to know. Those are the ones I've seen on UTI. You're gonna have to strain the urine. You can have a urine ultrasound or CT scan to assess where it's at. Treatment would be, to control the pain and to make the stones pass. So we strain the urine. We evaluate the type of stone just in case if anything comes abnormal. Moving is important, and drinking lots of water to make sure that they are the stones are coming out. Like think about it like you have something here, you're gonna drink water to like get it out of your body. So lots of fluids and ambulating. You want to limit your protein. I believe it shows up on ETI. You can have this. This is show up on ETI. It's sometimes, but you can have a shockwave lithotripsy that send shock waves to break them down, and they're easier to expel. But if they're hard, if they're a little bigger, then we have to do more invasive procedure, which is going in there and actually having a percutaneous nephrolithotomy, which is like an opening of your nephro, your kidney, and stones are removed. There's an incision that's being made in the back where the kidneys are located, and they remove it. So, but that's worst case scenario if they're bigger. But this, you want to make sure that they're ambulating. They have a fast recovery rate for non-invasive ones. So please make sure for ATI, you guys know signs and symptoms and treatments for it. Hopefully makes sense. And these are just different types of stones, but I wouldn't focus on this too much right now, just for right now. Let me see, cardiac terms. Oh, this is already cardiac. Okay, so we did that. Now we're gonna go and do the respiratory disorder 134. Okay. So this is your respiratory disorder, COPD. COPD is important to know. Everything's important to know. But COPD, you definitely hear nose for ATI. COPD, let's see, what do we have here? There are two types of COPD. And you have to know this because it does show up on ATI. They're the risk factors, but you have to know these two: emphysema and chronic bronchitis. You have to know both of them. So with emphysema, it's an abnormal extension of the air spaces right here. Your alveoli right here. Destruction of the terminal of the air spaces to the terminal bronchioli. So pink puffers, they're known as pink puffers. Okay, well, there's on simple nursing, it explains it a little better there. But what I need you guys to know is that for emphysema, you get a barrel chest that shows on ATI. You have weight loss because you're breathing a lot, so you're not you're burning out those calories. You have shortness of breath, obviously, you know, COPD, breathing problem, and severe, you have dyspnea, which is the same thing, shortness of breath. But those do show up on ATI, so please make sure you guys know that. You want to make sure that for COPD, it doesn't mention it here, but it does show up on ATI, where you want to be breathing in through your nose and out through your mouth, but in a pursed lip. Like you don't want to be like breathing out like fast. You want to make sure your lips are pursed. Pursed or pierced? I don't know. But you want to make sure you breathe in through your nose and out through your mouth. Slowly. And you want to do it like prior to going to like walking up the stairs. Save energy. Let me see. Okay, so blue bloaters are here. You want to make sure you notice blue bloaters. You're gonna be overweight, but you're very cyanotic. You're gonna have bronchi and wheezing and chronic cough. If anything, you please know it's a barrel chest. Get emphysema, you know, barrel chest out of it. You're gonna have this COPD does fall under respiratory acidosis. So if it shows up on EKI, it's respiratory acidosis. These two, COPD in general. You're gonna be overweight, so you're gonna be bloated. Blue bloaters, big and bloated, so overweight and very cyanotic because blue bloaters, right? These the airways are gonna be inflamed. You're gonna have a productive cough and sputum for more than 3 months or within 2 years consecutively, but definitely make sure to know the highlighted part. COPD, so here we go. You wanna make sure this is for lung sound, sputum, oxygen saturation rate. COPD, normal oxygen saturation rate for COPD is 88 to 93%. Is expected. 93%, because that's normal for them. So that's normal. Okay. Normal for COPD patients. Oops, sorry. Normal for COPD patients. You want to make sure smoking cessation. Anyone in general, like, oh, you do not want to be smoking. Like anyone, for all diseases, for all everything. If you want to be a healthy individual to be like 200 years old, you don't want to smoke. You don't want to do alcohol in general. But you know, like some people they do. Like it all depends on genetics and like you know, if they have a predisposing factor or predisposing factor. But just in general, you just don't want to be smoking, right? But then it all depends on like in real life, real world, not ATI. I can be smoking for like 20 years and still have to be 200. So that's real world. But ATI, you don't want to be smoking or doing drugs or alcohol, right? Determine readiness. So make sure you stop smoking, diet modifications, increase protein, increase calories, because you're breathing so much that you're expelling all these air that you're not you're wasting energy, wasting calories, burning calories. So you want to make sure you're eating proteins, nutrition, small frequent meals. Clients, especially emphysema, right? Emphysema. They use a lot of their energy to breathe. So small frequent meals, they're high in protein. You want to make sure you don't drink water with the meal. You want to drink it either before or after the meal, because that's how it's staged on ATI. You give them periods to rest, right, when you're eating. Pursed lips right here. Proper breathing techniques. So you want to make sure you breathe in through your nose and out through your mouth. It's very, very important to know. Breathe in through your nose. It doesn't show it here, but you want an ATI, it says states breathe in through your nose and out through your mouth. Pursed lips. Surgery, so you can have a lung transplant, but that's not, I haven't seen this on ATI, so no. Oxygen therapy, I'm sorry, forgot to go back here. They lose their oxygen, you know, they lose drip to breathe. What are you talking about? But I wouldn't, this doesn't show up on ATI. I haven't seen it on ATI, so no. But definitely make sure small frequent meals, high proteins, breathe in through your nose, out through your mouth, pursed lips. Stay up to date with your influenza and pneumococcal vaccine, please. You can do your bronchodilators, corticosteroids, all this. But first, you want to take your albuterol. That's your rescue inhaler, right? Albuterol first. Then you can do your ibuprofen, which is an anticholinergic. And you know how I stated before, corticosteroids are given right. Corticosteroids like prednisone right here. Please no prednisone. Cannot state stress that enough. That does show up on ATI, the signs and symptoms. So sepsis does cause sepsis. It does cause cataracts, hyperglycemia, osteoporosis, and weight gain. So please note that. Pneumonia. So this is a lower respiratory tract infection, the alveoli sacs. Healthy ones right here, right? And pneumonia, alveoli is inflamed and filled with fluid. So this is caused when you're not post-op, patient isn't ambulating, not doing their spirometer every 2 hours, and now they have a buildup of fluid in their alveoli, it's inflamed, and there's an impair of oxygen exchange. So here you breathe out CO2 and you breathe in oxygen, right? But it's impaired now. So signs and symptoms, you definitely need to know mild to high fever. Respiration rate is going to be increased. Saturation rate is going to be decreased. Chest pain for sure. Difficulty breathing, productive cough. Crackles and wheezes for sure. You have to know that one. And it does fall under respiratory acidosis. Not respiratory alkalosis, because that would be like someone who's hyperventilating. Don't look at this. Please make sure you guys know your ABGs. But just ignore this for right now. But the ones that are highlighted, those I have seen on ETI. Let's see, risk factors. So immobility, like we said, post-op, patients post-op. No, they don't move, post-op. Prior infection, or if you haven't taken your immunizations, or if you have COPD, disease, but mainly mobility and post-op. Interventions would be to monitor their vital signs, the sputum, if they're, if they have the consistency of it, increase calorie and proteins, and fluids. Make sure they drink lots of fluids, small frequent meals. They can take mucomyst agents, acetylcholine, right? It does cause a rotten egg odor, which is normal. A cough suppressant like codeine. They can do bronchodilators as well. Let me see, antibiotics, if it's bacterial or virus, we don't know until we get tested for it. That's why we do a diagnostics test, check for x-ray, sputum culture. Sputum culture, not blood culture. Sputum culture because it's bacterial and you want to know if it's bacterial, viral, or fungal. Intense spirometer, please make sure you do that every 2 hours. Hand washing and avoid sick people. Very, very important. Asthma is has a lot of causes, to be honest. It can be environmental, genetics, cockroaches can also cause that. Mites, a lot of things. Smoke, pollen, dirt. It could be environmental. like the area around that you live, there's a lot of dust or so. And, that can be a cause of it. So this is your normal airway. And when you have asthma, the airway is almost kind of blocked, which impairs, airway breathing. And you do have types: mild, persistent, moderate, severe. Severe is like, okay, like this is a medical emergency. But what you have to know for ATI would be you get dyspnea, shortness of breath, tachypnea, because you're trying to breathe fast because trying to get more air in your body. You definitely have wheezing. You use accessory muscles to breathe in, and this does fall under respiratory acidosis, so it's important to know. That's respiratory acidosis. Nursing interventions, airway, breathing, circulation. So airway's priority, high power position. You want to elevate the head of the bed, provide frequent rest periods. Their goal is to keep this, unlike COPD, where normal oxygen saturation rate is 88 to 93. Asthma patients, the goal is to keep it above 95. So that's important to know. Decrease stress. Make sure you're using your peak flow meter. That's important to know. If you have a status asthmaticus episode, it's a medical emergency. Oxygen, you have to give them oxygen. Try to do anything you can to give that patient oxygen or keep them hydrated and nebulizer. But this is a medical emergency. But for ATI, you have to know the peak flow meter. If it's green, it's good. If it's yellow, it's not so good. If it's red, it's bad. So you do 3 blows ATI, it does show up where you do you blow it 3 times and you get the highest number of those 3. And that would be your flow rate for that reading for that. Albuterol, right? This is for your short acting when you have like an acute attack. Long acting salmeterol prevents the asthma attack, but it's not used, for an emergency. And this medication does show up on ATI. It helps like prevent, asthma attacks and stuff. The thiophytolethine, mexo, so whatever. Please make sure you don't drink any coffee, soda, or tea. Anything that contains caffeine or chocolate too. Corticosteroids on the zone, you want to make sure to decrease the inflammation. So that's what I said. Important to know your prednisone. Zone. Very important to know that. Now we get into the hematology, iron deficiency anemia. Side note, there is one medication that does show up on ATI, and they sometimes state it as like it's on one of the flashcards for this sort for hematology. Am I saying it right? Let me see if I can take it out. It's like Ephon or Ephon alpha, something like that. That's how it looks, something like that. But basically, you want to make sure you correlate that with iron and hemoglobin, because that medication does help with, I believe it helps with increasing your red blood cells, or here, let me look it up. How do I stop sharing? Oh, I thought it wasn't recording for a second. I was like, what? Okay, that's stop sharing. I'll show you guys really quick. Oh wow. I find it. I saw it somewhere around here. But, oh, it's right here. Okay, hold on. We'll find it. Right here. This one. Okay. I know you guys. Let me see. It's right here. So basically, it's to treat anemia, right? It's you give this when patients they have low hemoglobin. Yeah. To treat anemia. So that is important to know. Go back to the this really quick. So iron deficiency and anemia, it's where you have decreased red blood cells. So you don't have red blood cells in your body. Red blood cells carry oxygen, and the oxygen isn't going, to the rest of your body. So now you have pallor, fatigue. You can't really concentrate. You feel like you have like a lack of energy. Your hemoglobins and hematocrit are going to be low, but on ATI, sometimes they'll have both hemoglobin and hematocrit, and they'll have you ask like, or which one is associated with like iron or anemia. Please make sure you do hemoglobin, because that's the one that carries the oxygen. Following RBCs and a protein that contains iron. So make sure you intake iron to make hemoglobin, because hemoglobin carries oxygen to the cells. That's important to know. So that's why your hemoglobin to hematocrit, hemoglobin will be important. But both are important, but if on ATI they state, okay, if both lab values are low and they ask you, which one would you report to the provider, it would be hemoglobin, because that one it carries oxygen to the body. So these are your normal values. Please make sure you know your hemoglobin and your hematocrit. I mean, the only way I remember it is because like hemoglobin reminds you of a goblin. So think of little kids, so little numbers. So female 12 to 16 and male 13 to 18. But I remember Mr. Moria, he had it a different way. He stated like what males 14 to 18. 14 to 18 for males, and females it was 16 to like 16 to sorry. Yeah, males 14 to 18 and females 12 to 16. So yeah. And the hematocrit, I think of older adults. 36, 48, 39, 54. I know it didn't help, but like, I mean, at least if you guys know the first one, right, the lowest number and the highest number, 12 to 18, that also helps. But I think of low numbers instead of bigger numbers because of goblin. Please make sure you eat iron-rich in foods. Oh, I'm so sorry. The reasons why you get low red blood cells, if you're bleeding a lot, like when you're on your period, or you don't have an adequate intake of iron, that can also cause, anemia. A lot of patients have anemia, and you get bruising too if you don't have enough red blood cells, or if you don't have if you have iron deficiency anemia, you get you can get bruises more easily. Please make sure you eat iron foods, so like your eggs. We get the short on ATI sometimes. Your eggs, apricot. I don't do apricots because like apricots does have potassium, and on ATI they state it as differently. Your eggs though. Eggs are important. Your legumes, iron, a lot of iron. Your fish have a lot of iron. Bread and meats have iron. Oh, iron fortified cereal has iron. So please make sure you know your poultry has iron. Chicken. So yeah. Okay. The reason why I don't want to mention potatoes is because like on ATI, potatoes, apricots, oranges, dried fruits, bananas, green vegetables. They associate that with like potassium. But what I've seen, with those for iron, for at least for anemia, or what food has more iron than those? So increase iron. It's very important. You can administer iron oral, or you can do IM. IM via Z-track method, or oral with the pill. IV if it's a medical emergency. But on ATI, I've seen it more as oral or IM. And if you're going to give it IM, it's Z-track method. Z-track method is where you pull the skin downwards, right? And that way you can get the subcutaneous fat out of the way, inject it 9 degrees, and let's say you're going to do deltoid, and then you inject it and then pull that skin back to have the medication go down deep in the muscle and not in the subcutaneous fat. Oral, make sure you drink it with a straw, in between meals, so not with breakfast, right? Dietary stools are normal. Constipation is gonna be normal, but make sure you drink fluids and fiber. Don't drink it with milk, and vitamin C does help absorb the iron. So decrease of no with milk or any antacids. The way I think about antacids, anti-antagonists, or anti-against acids, antacids, they don't like any meds. They're mean, and they don't like to be taken with any meds. And in general, antacids, you don't take them with meds. You wait at least, I think, an hour or two before you take them with meds. Milk, never with milk. And vitamin C, like fruit juice or multivitamins. Please use a straw and brush your teeth. These are normal. These ones are used to black stool and constipation. Take it with a straw and brush your teeth. Please. Thrombocytopenia is important to know. Let me see what else. Thrombocytopenia, because it does come up, but for peds. This does come up for peds. They have a decrease in platelets. So your platelets is 150 to 400. Platelets, I'm so sorry, I'm trying to highlight this. Your platelets are 150 to 150 to 400. The way I think about it is when you go to the store, right? You're having a party. You're gonna go have fun. You're gonna buy your plates to have your cake on. And if you're cheap, you're gonna get the $1.50 plates. But if you like the nice plates, like the ones that have little pictures, or the plates that are more durable, you're gonna pay $4 for the most expensive plates for your party. So that's how I think about it. So if you're cheap, you're gonna get $1.50, or if you like the most expensive plates out there, $4. So that's how I think about plates. But if you have a decrease in platelets now, your platelets aren't helping you clot. That's the most important thing you gotta know about the platelets. The reason why platelets function, what platelets are. So you can't clot, and if you can't clot, you bleed. And bleeding leads to hemorrhage, and that's not cool. You don't want to be bleeding out. So what signs and symptoms are going to be associated with this? So on ATI, I've seen purpura, which is bruising. I have seen prolonged bleeding times, your PT. Your PT prolonged, no, yeah, I believe it's going to be elevated. Yeah, right here. It's going to be elevated. Because you're taking longer to clot. Your INR is going to be elevated because you're taking longer to clot. Petechiae, which is bleeding, little red dots in your skin. They look like red dots. Bleeding from the gum, bleeding from the nose, stools in your urine. I mean, blood in the stool and urine. The causes are right here: platelet disorder, which is the main one, especially for pediatric kids. Platelet disorder. You can have thrombocytopenia, anemia, enlarged spleen, but what you got to know is the reason, what happens, right? what happens. And what happens is you get all these signs and symptoms. That's important to know. If you understand signs and symptoms, then you should be fine. Don't, for right now, don't focus on the causes. ATI hasn't mentioned anything about that, I believe. But does happen in pediatrics. So your PT, and INR, they're all going to be elevated. Your hemoglobin, hematocrit, they're going to be low. Why? Because you're losing blood. You need a platelet transfusion so that you can clot. Because, I mean, now you're not clotting, so you're bleeding out. So you need platelet transfusion or bone marrow transplant. Those two. Bleeding precautions, always is those show up on ETA for anything. For patients that are on warfarin, on heparin, or any anticoagulants or any antiplatelets, you always want to use electric razors. No aspirin because it causes bleeding. Decrease needle sticks and protect from injury. Don't be playing any contact sports. So no contact sports, no electric razors, soft toothbrush, no aspirin. You don't want to be taking any you want to just you don't want to hurt yourself, basically. Prevent any bleeding precautions, anything that causes bleeding. Doing that. Thrombocytopenic purpura does come up on ETI. Sorry. This is an autoimmune disease where the body produces antibodies against its own. Okay, so this happens, but in peds, and basically where you you're like clotting, but then unclotting, clot and unclot. So, like we said, it's a viral illness. The body produces antibodies against its own thrombocytopenia. So it's attacking its own platelets. So, like, if you want to have like 150,000 platelets, right? But then your body's like attacking that platelets, but then your body's reproducing the platelets, so it's going back and forth, right? So I believe that's all you gotta know for that. Make sure it's associated with a bruising, petechiae, but it's going back and forth. So no aspirin, no nothing. It's very short, straight to the point. Just make sure it goes back and forth. Clotting and clotting. These are your lab values that you have to know. D-dimer for our fragments of fibrins that are in the blood when the clot dissolves or is broken down. So please make sure you know, at least just make sure you know your ranges for ATI. Know your ranges. My blood cells 5 to 10,000. I wouldn't do this. I would do it the easy way, 5 to 10,000. Platelets 150 to 400, not 450. Hemoglobin, think of goblin, little kids, so little numbers. 12 to 16, 13 to 18. Hematocrit, they're a little older, so 36, 48, 39, 54. I don't know. I don't have a way of remembering that one. PTT, these two T's, they make an H associated with heparin. PT, warfarin. INR is for heparin. All right. Let me see. Put back up here. So we went over, we're gonna go over GI, 142. Maybe that's important to know as well. 142, let's go 142. 142, hold on, I'll be right back. Stop this. Can I stop this? Okay, I'm sorry. Technical difficulties. Pause. Yeah. Okay. Let me just share my screen really quick. Okay. So we're gonna go over GI right now. So GI. I don't like this right here. This is so much. But you do have to know that it's very, very important. Let me see if I can make it ooh. Okay, that's neural. Okay. Acute, so patho is where the pancreas, they don't secrete, it can be a lot of things, right? If you have pancreatitis, pancreatitis is an auto digestion of the pancreas by its own digestive enzymes released too early in the process, in the pancreas. What does that mean? So it basically means that, give me a second. Let me rephrase that. Hold on. Scratch that out. I wish I could just like scratch it out. Hold on. Let me gather my thoughts again. Let me pause this right. Okay, so now that I got my thoughts, so you have acute versus chronic pancreatitis. Your pancreas, please make sure you know where your pancreas are located in your body. So it should be like up here, somewhere up here, right there. But the patho is so pancreatic tissue secretes digestive enzymes that break down carbs, fat, and protein. Right? If you go back to like, if you can remember back to like the first, I believe, week of term 3, we went over the pancreas and how it secretes I believe it secretes insulin. It has 2 functions. It secretes insulin, and it's also secretes like digestive enzymes such as amylase, lipase, and protease. So your lipase would be the enzymes for, I believe this is for fats. Your amylase, here's the other one. Amylase, okay, don't quote me on this, but I don't have it right here with me. I know I had a paper, a picture. Oh, right here. Okay, found it. So your protease is your protein, your lipase is your fat, and your amylase are your carbs. But for right now, we don't memorize that for ATI. But what you got to know is that the patho is that the pancreas has 2 functions: one to secrete insulin into the bloodstream, and the other one is to secrete digestive enzymes that break down carbs, fat, and protein. Because when we consume carbs, proteins, and fat, we need these enzymes to help digest it into our body, right? But when we have pancreatitis, which is an inflammation of the pancreas, these enzymes, they're not, they're, what's it called? They're not being excreted. So let's see. Pancreatitis is an autodigestion of the pancreas by its own digestive enzymes released too early in the pancreas. So we will see an increase in amylase and lipase. Those 2 are important to know. And I want to say that this is going to be a chronic. We fall under chronic, right? Type of inflammation that is irreversible. What you got to know is that, so in other words, what I mean by pancreatitis is that there's an inflammation in which enzymes are activated early and they eat itself. So they're not being expelled into where they need to be to like to absorb the carbs, fat, and protein, to break down the carbs, fat, and protein. So this can be caused because of alcohol abuse, or if you have cystic fibrosis, or if you have like a gallbladder disease. So over here we go into chronic. If you have an excessive consumption of alcohol, this can lead to pancreatitis, inflammation of the pancreas, where they're not secreting carbs, fat, and protein, which is your amylase and lipase. Or if you have cystic fibrosis, patients that have cystic fibrosis, they have this buildup of like mucus, right? And they don't let the carbs, the enzymes go out and digest and break down the carbs, fat, and proteins. So you're going to have an increase in amylase and lipase. So cystic fibrosis is also a problem, also something that causes pancreatitis, long-term chronic, so irreversible, and alcohol too. So in chronic, you will see different types of symptoms versus the ones in acute. You will see epigastric pain or no pain. I haven't seen that on ATI, so I'm not going to really focus on that. But I need you guys to make sure that you guys do know that you do get stynorrhea, fatty stools. Why? Especially in patients that have cystic fibrosis, you get fatty stools because you don't have those the fats. Your lipase isn't breaking down your fats. So now when you poop, right, you're gonna get fatty stools. But when you go to the bathroom and from stool from bowel movement, you're gonna have fatty stools, oily, greasy, frothy stools. So for cystic fibrosis patients, we want to give them medications such as the medication. It's a one medication that you give 45 minutes prior to. No. Sorry, that's the other one. That's for some other medication. Hold on. This is a medication that you give. What are they called? You want to give them with the meals, so that way they're able to break that down. And once they're able to break that down, then you don't get any more fatty stools. Cystic fibrosis. Where do I have cystic fibrosis? I have it somewhere here. Let me look for that med really quick. Do I smell? Look for the med really quick. Okay, so you want to give them your pancreas. That's all. They end in ASE, and basically you want to give it to them with a meal and a snack, or you can break the cancellate capsule or sprinkle the enzymes of foods that are acidic into the applesauce. And this will decrease the stynorrhea. So your pancreas. They are more prone for getting infection on patients with cystic fibrosis. Because they're going to have a low WBC. You want to make sure that you keep them away from sick people, patients that have cystic fibrosis, and you want to make sure that you have them wash their hands. It's important to know for cystic fibrosis. You monitor their weight loss. Any weight loss of 2 or 3 pounds is you have to let the HCP know. Jaundice, you monitor for that. For the yellow sclera, the skin from the biblical bile. For acute pancreatitis, right, when you have gallstones that are stuck in the bile duct and they don't let the enzymes out to digest or break down the carbs, fat, and protein. This is acute because once you get rid of that problem, it is reversible. So if you have blocks in the bile duct, and let me just show you guys the bile duct, so you guys know what I mean then. This is acute pancreatitis. So this is your bile duct right here. This is your gallbladder, your common bile duct right here. And if you have a stone stuck in there, you see the pancreas is right there. pancreas, these are going to be stuck right here. Let's say stuck right here. So when these enzymes are being secreted, they can't go down here into the bottom, the intestines, and break the enzymes, break anything else. See, common bile duct right here. One is stuck right here. Let's say the enzymes, they can't go. Now you have acute pancreatitis. Alcohol damages the pancreas, but if you are taking it excessively for prolonged consumption of time, then it becomes chronic. But if you're taking it for, let's say, 6 weeks or so, it damages the pancreas, so you have acute pancreatitis, and you want to stop, right? You don't want it to become chronic, because otherwise, if it's chronic, then the pancreas, you can't go back. It's not reversible. It's not treatable anymore. If you have an infection, if you're taking medications, that can cause acute pancreatitis, where the enzymes are not being secreted out. So you got to fix that. Treatment. You have to get treatment to get it fixed. Now, acute pancreatitis, right? So you're gonna have mid epigastric pain, lower upper quadrant pain. So if you go over here, your little abdomen, lower left upper quadrant pain. So mid epigastric pain. So somewhere around, this is your right, left upper quadrant pain. So mid epigastric pain, around there. You are gonna have confusion and agitation. That's important to know. Rigid board-like abdomen. I've seen this on ATI for sure. You have to know that. You have to know colon sign, which is bluish discoloration of the umbilicus right here. It does show up on ATI, so please make sure you know that. And the Turner sign, bluish discoloration at the flanks. Please make sure these are important to know for ATI. So amylase, right here. Amylase breaks down carbs to glucose, proteins, and lipase to fats. So P to P, lipase, fermenting fat, so fat and amylase. But don't memorize this for right now. Just know that if you have a problem with the pancreas, pancreatitis, acute or chronic, the enzymes are all going to be elevated. So medications, your pancreatic enzyme that you give them with food, some opioids for pain, but the most important one to know would be your pancreatic enzyme with meals. So diet, no alcohol, because that damages the pancreas. Increase in protein, no fat because that causes fatty stools. And since you already can't, break down that fat, why would you want to consume more fat? Complex carbs like fruits, veg, and grains. Complex, the way I think about it between complex and simple carbohydrates is complex is more complex for people to understand how to choose the good foods, the healthy foods. When you go to the store and you tell somebody, hey, I'm looking for, the complex carbs, they're gonna be like, what is that? Or when you're dieting, you're trying to diet, you're trying to figure it out, what are the good healthy stuff, how there's a complexion there, but you're trying to distinguish between what's healthy and what's the bad. So I just think complex carbs are a little harder for people to to figure out which fruits have the most proteins and stuff like that. It requires more thinking because you want to get the most nutrients out of whatever you're intaking. So fruits, veggies, grains. Because simple carbs are easy to make. They're the ones that you microwave in the microwave for 5 seconds, and like macaroni, and then macaroni and cheese, I believe. Simple, carbohydrates. So interventions, rest the pancreas. So we talked about this. So we put them on NPO. We don't want to stimulate the enzyme. So we can do NG tubes, I believe. Yeah, NG tubes. We talked about this during the live review. Insert NG tubes, remove stomach contents. And you want to make sure they're on NPO, IV fluids. You want to make sure that they're side-lying. You monitor their glucose intake and output. So now for inflammatory bowel disease, Crohn's and ulcerative colitis, it's very important to know. Very important to know Crohn's and ulcerative colitis. So I have a picture right here. If Let me show you guys. So colitis and Crohn's disease. So this is what I use. I mean, I believe Simple Nursing does also have a video on it. I haven't checked it out yet. I was recording. Oh no, sorry. How do I stop sharing? Okay. So Simple Nursing does have a video on it. He explains it a little better. But I have these that I was using back in like a long time ago. From Stephanie, I believe it's her name. And it goes over Crohn's disease and ulcerative colitis. What you have to get out of this is that Crohn's disease happens anywhere. Right here. Let me show you this picture. You can see it. But this is your normal one, right? Your normal body, how it looks like. But Crohn's disease can happen anywhere in your intestine, small intestine, large intestine, anywhere. Ulcerative colitis is only right here in your, I believe it's, it happens in your colon, I believe. That's the area. Sorry, I'm trying to figure out the proper name for it. But then if I'm ulcerative colitis, yeah, it's in the colon and rectum only. So yeah, that's what you gotta know. But you have with these, it's very important that you guys know. Let me go back to sharing screen. This very important. So Crohn's disease inflammation that occurs anywhere in the GI. Make sure you know that. Mouth to anus. It can happen anywhere. And ulcerative colitis, just only in the large intestine and rectum. So, signs and symptoms of Crohn's disease. You have to know that you get gobblestone appearance and mucus like diarrhea, semi-solid. And I believe you also get abdominal distension. I have seen that one, I think, somewhere. Ulcerative colitis, there's a cure. You can have a cholecystectomy, ileectomy, little small pouch. And you want to make sure that your symptoms could be dehydration, bleeding, bloody diarrhea, abdominal cramping, vitamin K deficiency, because your electrolytes and everything, you have malnutrition, so you're going to be skinny because you're not absorbing anything. But there is I'm going to say there is a med that you can give them for ulcerative colitis. Since, the only cure would be to have an ileostomy. Ileostomy or colectomy, surgical removal of the colon. But then have the ileostomy, but we want to make sure that we encourage, avoid nuts, veggies, high fibers, fruits, dairy. Encourage more high protein, high fluids, and low fiber. We want to give them what's that one? Sulfasaline. There's a medication you can give them. It helps with with that. The Crohn's disease, on the other hand, though, for how we want to fix that or treatment for Crohn's disease, an anti-diarrheal. We can give them sulfasaline again. We can also give them another med, dicyclomine. That's what it was. Because you're gonna have, I believe we have lots of stools coming out. Where is that? Sorry. Yeah, dicyclomine is an anti-diarrhea. 20 stools per day. Let me see what else I have in here. Interventions. So monitor, so their NPO, we want to monitor their fluids, Diet clear fluids, decrease fiber. Clear fluids to decrease fiber, increase protein. Avoid gas forming foods like all these. You have to know them. So monitor bowel sounds, peritonitis. Peritonitis for sure you want to know, because if something happens, right? If let's say something ruptures or something, and now you get the bacteria in here, and that can cause, inflammation, peritonitis. And that's not good. You don't want that. Your stool, want to make sure you keep it. You assess for any blood. Bowel sounds, make sure it's what you want to hear. I believe you want to hear 5 to 30 gurgles. Now, something else I wanted to mention for this is your diverticulitis. We talked about it last night, and diverticulitis, we went over that like a long time ago. Basically, you're going to get like these little pouches around here. And when the food gets digested, right, and it's around here where, it gets, it's mainly over here, down here next to your sigmoid colon, your descending colon right here. But once the feces kind of like is on its way down to the rectum, because before it goes to the rectum, it's going to get converted into like feces and all this, the body itself does that. But you're going to have little pouches right here, and all of that is going to go into the little pouches, and it's going to get stuck in there. And it's like when you don't clean your room, you get all this dirt, right? And it starts forming like bacteria, starts smelling bad and all that. So now you have that, and if that gets ruptured, if somehow, some way it ends up going into your body, like your intestines, that can cause peritonitis. So you want to monitor for that. Types of hepatitis you want to know, because this shows up on ATI. I think it showed up on what are the capstones? You can show up in. But make sure you know A, B, C, D, E. And the way I remember it is B, C, and D, they're alike. These are the same. Blood and bodily fluids. B, C, D. B and D are the same, C and D are the same. C, though, you got to make sure it's for IV. More common IV drug users. Okay. And A is just fecal and oral, food and water, basically. Food and water, and E, the same thing, food and water. If you know B, C, D are blood and bodily fluids, then A and D are fecal or that's what you have to know. For all of these, you have to make sure you assess for jaundice. It's important to know. I wouldn't focus on this right now, but that's what you got to know. B, C, D, blood and body fluids, and A and E, fecal and oral. Avoid alcohol, acetaminophen, and aspirin for the liver. Acetaminophen is very toxic to the liver, as well as alcohol. You want to make sure small frequent meals. Do not share personal hygiene products. You want to rest. Because it's liver, right? Your liver pertains to ALT and AST lab values. Don't memorize this for right now for ATI, but they're all going to be elevated since your kidneys aren't functioning correctly. Your bilirubin, if you have high bilirubin, you're going to have jaundice, because I forgot how it was stated, but like your body isn't breaking down the red blood cells, and the red blood cells are like the tissues in your body. So now you get an increase in bilirubin, and that causes jaundice. I don't know if that makes sense. Basically, if you have jaundice, you're gonna have increased bilirubin because you're gonna have dead red blood cells. Pneumonia. If your liver isn't functioning, you're gonna have increase in pneumonia. And this is what I wanted to mention about like, the liver, because it's very important that you know the liver and its function. The liver is very important, but the liver has it's very important that you guys watch Mike from Simple Nursing for liver, because he does state a couple of things in there. And the liver produces albumin, bile, and coagulation factors. Albumin transports drugs, which binds with calcium and tracks water, right? Or just in general, transports drugs. Sorry, that's the way he stated it. But bile gets rid of cholesterol and bilirubin, which is secreted from the bile duct, the green little thing that we saw earlier. And it also coagulates, right? So albumin, if the liver stops functioning, you have hypoalbuminemia, meaning drugs don't get transported, water builds up, causing edema and ascites. Now you're going to have low calcium that leads to osteoporosis and causes trosu and chavox. Trosu, remember, it's the little hand thing, right? Hand goes all weird when you put the blood pressure on. And the chavox is the facial drooping. So the bile doesn't produce, get rid of cholesterol, so now you're going to have an increase in cholesterol. And because the bile isn't functioning, there's a buildup of bilirubin, which turns the body jaundice. And coagulation factors, so you're going to have increase in PTT. But what you got to know for liver is we can cause cirrhosis. Oh, so sorry. Oh, it's right here. Hold on. Okay, yeah, it's this one right here. So cirrhosis. Yes, this is what I was talking about. So stages of liver damage: healthy liver damage, cirrhosis liver, destruction. See, it becomes all this fatty little thingy right here, fatty liver, and you can't go back to a healthy liver. So functions of a healthy liver is to detoxify the body, to clot, to metabolize, and to synthesize, or to make, aka make, albumin. If the liver is destroyed because of, let's say, chronic alcohol consumption, right here, or because of hepatitis B or C, mainly C, or because there's fat collection in the liver because of increased cholesterol, obesity, or diabetes, or if you have been taking like drugs that affect the liver, such as acetaminophen, very toxic to the liver, then you are most likely, you're damaging your liver. So now you can't detoxify the body. You can't help clot. You can't metabolize the drugs. You can't make albumin. So you will get signs and symptoms of asterectosis. This is important to know. Asterectosis is twitching. So you will get twitching. You will get jaundice because you have an increase in bilirubin now. Ascites because you have an increase in albumin. You will have itching. Itching from the psoriasis, aka pruritus. It's important to know. Increased bilirubin and ammonia. Ammonia, when you have an increase in ammonia, it does affect your thinking. You're gonna have confusion. So you will want to give them a laxative of lactulose to decrease ammonia levels. And once you know that lactulose is functioning, then you will see an increase in cognition level. It will go back. But what I wanted to say for ascites is that ascites is that buildup of fluid in your abdomen. And the only way to get rid of ascites would be to do a paracentesis, which you would need a patient's consent form for that because it's invasive. And you want to make sure you empty your bladder prior to the procedure, because if you don't empty your bladder, then you're more prone to puncturing your bladder, and that's a whole other story right there. So make sure you empty your bladder, you measure the circumference of the abdominal, and you place the patient in high pelvis position. Your diet, you want it low in protein, low in sodium, low in fluids, no alcohol, soft versus toothbrush, no vascular maneuver. Complications, so portal hypertension, portal vein becomes narrow due to scar tissue. So that's why I said it's very important to go watch that video for simple nursing if you guys can, because he does explain it very well. I mean, I have my notes right here. I can read it after I'm done. I can over the notes on here on screen. But I'm just highlighting what's important because it's important to know. Splenomegaly can happen because they have an increase in albumin level. So now that water isn't being transported. So now all these organs are becoming very big. You're gonna have esophageal varices. So no, you don't want to do it. You want to make sure that there's a sideline if it pops, the esophageal varices, because you don't want to make sure, you want to make sure that they I will show you guys later. Hold on. Let me show you guys the video actually. Let me show you guys the video really quick. So hepatic encephalopathy, because of the increase in ammonia levels, that's what we give them lactulose. Let me see those medications, lactulose. You have to know this medication for the liver, especially because they're gonna have increased ammonia levels. It's gonna have them have this like confusion onset. And the only way you find out whether if the medication is working is if they have an improved cognition, right? Treatment, no alcohol, on bleeding precautions because they can't clot because the liver isn't functioning anymore. Monitor intake and output and weights because of the increase in albumin, abdominal GERD because of the ascites, paracentesis, right? To remove the fluids from the peritoneal cavity, or you can have a liver transplant. Remember, liver, you can like, if somebody can donate half of the liver, their own liver, the person that donated it, donor, it regrows. Use an electrical razor, soft toothbrush, because remember they can't clot. Not to all for this, but I will show you guys. Read my notes to you guys right now. But this is what you guys need to know for ATI. Neurological assessment, so LOC changes. Make sure you guys know PERLA. Pupils equal brown reactive to light accommodation. This you gotta know your tendon reflexes. The 2 is normal. That show up on ATI. Make sure you guys know at least what the glaucoma scale is, which is a response to stimuli. So opening of the eye, verbal response, motor response. Motor response does show up on ATI. So make sure you guys know that. Make sure you guys know that Babinski is normal in infants up to 12 months, right? Where you do this curve and the toes curl upward, that's normal. But remember, that's only normal in newborns and infants up to 12 months, but abnormal in adults. So that's what I want you guys to know for that. Seizures, we went over this already. I'm not gonna go over this just because like I'm pretty sure you guys know this. Did I go over stroke? I think I didn't go over. Yeah, I went over stroke. And 3, you have to know this one. Here's number 3. 1, 2, 3. This one does show up on ATI. It's visual though. The answer. Yeah, make sure you guys know the Snellen chart. Please make sure at least know what it is. Which is for the eye. But 3, oculomotor does show up, but on ATI it's stated as like you're testing for, I believe it's like, it's not this pupil constriction, I think. But there is one on there on ETN. I forgot which one it was. Make sure you guys know your Rhine. Your Rhine. Your Rhine, think of like ringing of the ears, ring up here, and Weber's up here. Make sure you know your rhombers, which is for balance. There's already one over that. I think that's it. I will read you guys my notes right now really quick because I need you guys to know this way. Okay. Okay. So let me see if I can, or maybe I can just show you guys video. Let me show you guys the video. I think that would be good. Share my screen again. I hope YouTube doesn't pull it out though. Where's my, yeah. Wait, can I move this? How do I move this? Ah. Okay, wait. Where is it? Right here. The library. This one. Okay. Okay. That's the whole video, but I want to hopefully the liver song helps.
It's beginning to look a lot like cirrhosis, jaundice of the skin, from the hyperbilirubin, waste products of hemoglobin, due to lack of bile production. It's beginning to look a lot like ascites, fluid in the abdomen, from the portal hypertension, the lack of albumin, increased capillary pressure causing third spacing. The liver acts like recycling company for major roles and responsibilities. Detoxing ammonia and drug metabolism, storing glycogen, producing bile coagulopathies and albumin. It's beginning to look a lot like encephalopathy with altered LOC. Too much ammonia in the blood, byproduct of protein metabolism. Give lactulose to aid the excretion. It's beginning to look a lot like cirrhosis. Soon we'll do a paracentesis. Drain the fluid from the abdomen, then give albumin. Bring the fluid back into the vascular spaces. Hopefully you liked our liver cirrhosis song. You can get it for $1 on iTunes or Google Play for Android. Simply search Simple Nursing in your music store. We also have 8 other songs in our full album.
Okay. It's very important that you guys know, at least go over cirrhosis. This one,
Now for cirrhosis, the big liver.
you have to know this. If you guys can't, at least just watch the video. But that's a really quick version of it. And I think that's all I have for you guys today. I mean, I'm sorry that I went so fast, but I mean, there's so much that there is to know. And like, I mean, I just try to give you guys what I've seen on the ATI. And hopefully it helped. But yeah, that's it for today. Okay.